how on a day? Good morning, this is Dr. Doni TV. How on a day? Greeting to you all. Today, what we want to talk now, the part 3 of what we don't talk about since 2 days ago now, the AS genotype. Waiting be the problem when they associate with, why people should be discouraged, and why people who have the financial aid can carry on with it if they can do those things we've listed in part 2 of it, which is the amniocentesis and also the CVS investigation to know the genetic makeup of the fetus that are carrying, if they can afford it, because it's usually expensive, isn't it? So if they feed one, may them carry on. But people when they feed one, to avoid the things when go feel happen to the baby when they go born for future, with those ones when go come down with the AS trail or the SS sickle cell disease, make them no go ahead, because the thing now serious issue they cause for the children when they born. So some of them when they exposed to cold, then go they sick. When any small thing happen to them, they go they sick. Then go can get low self-esteem in the society. It's not actually a good one. So that is why we are talking about this for the past 2 days now. Today, a lot of people have asked us saying, Doctor, what can we do? Are there any things that are risks that are associated with this? Yes, quite all right. There are risks that are associated with AS genotype sampling, such as when people who want to do the genetic makeup assessment, the CVS, some of them, even as time goes on, after a successful procedure, they've known the genetic makeup, most of them go feel they get miscarriage. And you know good, you know when you don't carry belly, reach 10 weeks, 13 weeks, because these are the time when the CVS is done. You come the final say 15 weeks, maybe after 1 week interval, miscarriage go come happen. The pregnancy when they try protect go come out. You see, say not be good thing. So one of those things you should look out for is miscarriage. There are tendency and the risks of them having miscarriage. How about infection? Because of the procedure, the technique, that the processes of doing this thing, most of them can have infection, and if this infection gets to the blood, it becomes sepsis, and when it upgrades to another level, it becomes septicemia. And these are things that can actually make someone to buy, somebody can buy out of infection. If it's the infection that is affecting the blood, the person will feel after a while, if the WBC cell count is above 12,000, and the person did not treat it appropriately with appropriate antibiotic, or maybe who knows, the person is already resistant to antibiotic. These are why we've been encouraging people not to take drugs. Anyhow, you find out say this person go fake by. So you see, say even the procedure where they say it good, you also get your own repercussion. You understand? So what do they talk today now? And the part 3 of the AS genotype. If you must go ahead to marry, you must be ready.